They will be the topic for today. We'll start with this topic will be on ameloblastoma. To start with, we'll have an introduction. What introduction? The permutation of different cells of different origin makes odontogenic tumors a highly complicated group of lesions. The permutation of different cells of different origin makes odontogenic tumors a highly complicated group of lesions. So in that category, we have got epithelial odontogenic tumors. In epithelial odontogenic tumors, we consider it under two headings. One is minimal inductive changes in the connective tissue, and second one is extensive inductive changes in connective tissue. So epithelial odontogenic tumors can be classified into two. One is minimally inductive changes in connective tissue, and second one is extensive inductive changes in connective tissue. The first category, in minimal inductive changes in connective tissue, we got three varieties. The first one is ameloblastoma. Second one is CEOT, a calcifying epithelial odontogenic tumor. It's also known as pin box tumor. Okay, calcifying epithelial odontogenic tumor. It's also known as pin box tumor. And we got AOT. AOT is adenomatoid odontogenic tumor. The second category, we got extensive inductive changes in connective tissue. Under that heading category, we got ameloblastic fibroma. The second one is ameloblastic fibroadenomatomy. Third one is odontoameloblastoma. And fourth one is odontomes. In odontomes, we got two varieties. One is complex odontome and second one is compound odontome. Okay. So extensive inductive changes in connective tissue can be under that heading comes here ameloblastic fibroma, ameloblastic fibroadenomatomy, then odontoameloblastoma, then odontomes. And odontomes you got complex as well as compound odontome. Then I got mesodermal odontogenic tumors. Okay. Under mesodermal odontogenic tumors, we got central odontogenic fibroma, then odontogenic myxoma, then cementoma, and dentinoma. Okay. So under cementoma, we have got three varieties. That is periapical cemental dysplasia, then cementifying fibroma, and benign cementoblastoma. Okay. So under mesodermal odontogenic tumors, we have got central odontogenic fibroma, odontogenic myxoma, we got cementoma. Under cementoma, we have got three varieties. One is periapical cemental dysplasia, cementifying fibroma, then benign cementoblastoma, and dentinoma. Then we have got malignant odontogenic tumors. Under malignant odontogenic tumors, we have got odontogenic carcinoma and odontogenic sarcoma. Okay. Under odontogenic carcinoma, you got primary intraosseous carcinoma and malignant ameloblastoma. Under odontogenic sarcoma, you got ameloblastic fibrosarcoma as well as ameloblastic odontosarcoma. Okay. So basically, two varieties are there. One is odontogenic carcinoma and odontogenic sarcoma. Under odontogenic carcinoma, you got primary intraosseous carcinoma as well as malignant ameloblastoma. And odontogenic sarcoma you got from ameloblasttic fibrosarcoma as well as ameloblasttic odontosarcoma. Then coming to ameloblastoma in particular, okay. The WHO in 1992 classified, they given a classification telling that it's a true neoplasm of enamel organ-like tissue which does not undergo differentiation to the point of enamel formation. So, according to WHO, ameloblastoma is a true neoplasm of enamel organ-like tissue which does not undergo differentiation to the point of enamel formation. So, enamel formation doesn't happen, but it's something like look-alike of your enamel organ. Then, according to Robinson, which is being usually preferred to have this in Schaefer, it is given like, according to Robinson, it's a tumor that is usually unicentric, non-functional, intermittent in growth, anatomically benign, and clinically persistent. Okay, so ameloblastoma is a tumor that is usually unicentric, non-functional, intermittent in growth, anatomically benign, and clinically persistent lesion. What are the other names for ameloblastoma? Previously, ameloblastoma was known under the name of adamantinoma. That is excess mandible, something like. Then something like multilobular cyst, it was called according to the radiographic features. Then again, it has been known as adamantoblastoma and Eve's disease also. Okay, so previously these all terms have been outdated now. Now we have got something called ameloblastoma in particular. Okay. So who has coined the term? It was first recognized by Cusack in 1827. It was described by Falson in 1879. The name adamantinoma was coined by Malasses in 1885. The term ameloblastoma was given by Ivy and Churchill in 1984. Okay, so after that, again it has been classified as unicystic ameloblastoma. The term unicystic ameloblastoma was being given by Robinson and Martinez in 1977. So this is just for your knowledge. Okay. So the term ameloblastoma was coined in 1934 by Ivy and Churchill. Then unicystic ameloblastoma by Robinson and Martinez in 1977. Then what is the origin of your ameloblastoma? Cell rest of enamel organ. Either it can be from a dental lamina or Hertwig's root sheath or cell rest of Malasses. Okay, so these are the cell rest of enamel organ. It can arise from these three portions. One is your dental lamina remnants, then your Hertwig's root sheath, and then cell rest of Malasses. The epithelium of odontogenic cyst gives rise to dentigerous cyst and odontomes. Any disturbance in developing enamel organ, you got heterotrophic epithelium in other parts of the, especially in the pituitary. So basal cells of oral epithelium. So these are the particular regions or your origin where it can arise from. Okay. So one is basically it arises from your cell rest of enamel organ like a dental lamina, Hertwig's root sheath, as well as your cell rest of Malasses. Then from epithelium of any odontogenic cyst and disturbances in any developing enamel organ, any other heterotrophic epithelium in other parts of the body, especially your pituitary gland and basal cells of oral epithelium. Dental lamina, ameloblastoma, oral epithelium. What are the incidence of your ameloblastoma? It constitutes around 1% of your oral tumors and consider 18 to 20% of your odontogenic tumors. Okay. And what are the critical features? What is the age predilection? Will be somewhere between 20 and so middle age group 20 and 50 years. The number of cases reported in children, the youngest reported was 1 month old, and the oldest reported was 98. Sex predilection. The mandible is the mandible is commonly affected, more affected than a maxilla in a 3:1 ratio. Then coming to the signs and symptoms, the patient usually will be asymptomatic. Facial asymmetry definitely will be there. It says slow growing as well as non-tender. In later stages, when it gets infected, pain starts. Okay, so usually they are asymptomatic. The first thing is look for your asymmetry. Then lesion will be it's very slow growing as well as non-tender, slowly progressive. Okay, so in later stages, pain can arise. If it is secondly infected, ulceration can happen. Then it eats up the surrounding buccal bone. So when you touch that region, you got something called eggshell crackling, which is typical of any cyst. Okay, then you got extra small nodule like. So how an ameloblastoma classified? Regarding the anatomic site, you got central ameloblastoma as well as peripheral. In central ameloblastoma, it's also known as intraosseous, whereas the peripheral is known as extraosseous. In central ameloblastoma, under the heading, we got multicystic, unicystic, as well as solid. Multicystic goes by another name, conventional. Conventional, then you got unicystic ameloblastoma as well as solid ameloblastoma. In periphery, extraosseous. And coming to your radiological features, usually it will be it's any radiolucent lesion of varying diameter. Sometimes it might be a honeycomb appearance may be given, sometimes soap bubble appearance. Then unicystic radiolucent lesion is it can get some if you write a differential diagnosis of any cyst, you can always include unicystic ameloblastoma. So which will be unicystic and radiolucent lesion. So coming to the radiological features, next class we'll continue with the next class.